All right. Good morning. Good morning, everyone. My name is Lindria Wynn. I'm the enrollment director here at Impact Health Sharing. And I know you guys are excited to learn a little bit more about our program. And we're hopeful that you guys will be our new extended family after today's session. I just want to introduce a couple of the Impact team that's on the call this morning as well. I'm not sure where their boxes are in relation to you, but Dr. Sheetal Maharaj, she is our medical director. She is also on today's call, as well as our VP of Operations, Miss Eileen Ryan. And they are also a part of our Impact staff, and we'll just be here to educate you guys. We'll go over some frequently asked questions at the very end, as well as answer any of your more pressing questions. Go ahead and drop those in the chat, and we'll make sure that we answer them as thoroughly as we possibly can. Sounds good? Awesome. So we know your time is valuable, so we'll go ahead and get started. We just want to give you a really strong overview of the program, help you understand today what Impact is and what it is not, so that you can obviously make a pretty educated decision about, your healthcare. So let's go ahead and jump right in. Affordability and pricing gets a lot of us excited here at Impact. So we'll talk about that first. The monthly share prices that you'll see is what your household is actually responsible for monthly. So the associated PRA, I'm not certain if you've had a chance to visit our website at www.impacthealthsharing.com and just see the prices overall. You can run a general quote for yourself and see immediately what you and your household would anticipate paying monthly. So the associated PRA, or primary responsibility amount, is actually what your family is responsible for meeting collectively before the eligible expenses are shared with the other members of the program. I'll give you a quick scenario. So let's just say there's a family of three, and your son breaks their leg. What you'll do, Angie at the beginning actually showed us her Impact card. So everyone here will, thank you, Angie. Everyone will actually receive an Impact membership card. And on the very front of that card, in addition to all the members that are participating in the program in your household, right on the corner, there's provider fees. Those provider fees are very similar to a copay. So it's what you can anticipate paying at the time of service. If you're visiting your primary care physician, it's a $50 provider fee. Urgent care and specialists are $75. And the emergency room, which in this scenario seems most fitting for a broken leg, would be $150. So let's just say you go, you pay your $150 provider fee at the time of service, and then they are going to do whatever they need to do to make your son well, fix him up, send him home with a cast, and then in a couple weeks, we will be getting a bill from that provider that you visited directly. Impact's membership card has everything that the provider needs to send us the bill directly. If you're just coming on, please make sure that you mute your, I think that's, Jean, it may be you, so I'll go ahead and mute you. So that's what you'll be anticipating. Your experience should be very similar to if you already have an insurance plan in place. We will be receiving that bill directly. And then from that point, we will go through a process in our billing department where we reprice the medical bills. This isn't a new process. If you've ever had insurance and you've ever gotten an EOB from your insurance company, that this is not a bill notice, we send out something very similar. It's called the explanation of sharing on our end of things. And from there, you'll see what we were initially billed, and then the repriced amount is what you're going to be responsible for. Again, that PRA is what you will have to pay first. So that repriced amount, let's just say the bill we got was $5,000 and we repriced it to $3,000. So that $3,000 is what you are responsible for up to your PRA. Let's just say in this particular scenario, your household selected a $2,500 PRA. So of the repriced amount, that $3,000, you're responsible for the first $2,500, and that will meet your entire household PRA. And now that remaining $500, you are now in what's called our co-share process. This is very similar to a co-insurance situation. So if you're familiar with that 80-20 split or the 70-30 split, after deductible, the co-share is what you can anticipate, and that is a 90-10 split. So of that remaining $500, you would be on the hook for just 50, and the remaining $450 will actually be matched and allocated with the varying members of our program, and a provider will receive a check from Impact directly for $450. Of that initial bill, you would have only paid $2,550 for that entire bill.
Are you sharing a screen? I'm getting a message asking if there was something that you were sharing, should be sharing, because they can't see it.
No, I'm not sharing a screen right now.
All right, thank you.
Is there something that you guys would like to see? I can definitely show the pricing page.
It was like a visual, but if not, that's okay.
No visual at the current moment. If there's something that you guys would like to see, just let me know. I can definitely pull it up for you and share the screen. But I just wanted to give you a real life scenario of what you can anticipate when you go to the doctor. From that scenario, you'll notice that we use some really different terminology than what you're probably used to. And the primary reason for that is because we're not insurance. As a not-for-profit, we have no financial motives whatsoever involved in deciding what happens with your medical bills. Like, we have no financial motivation to deny a medical bill. If it's eligible, it will be shared according to, the reserves that we have available. Also, unlike insurance where they actually pool the money, like I mentioned in the scenario, we notify the members. Let's just say everyone here is an individual household. You would be notified if your reserved funds were utilized to pay another member's eligible medical bills. So that's the key difference. You know exactly where your money goes each and every month. Our program is actually membership based. So that means that everyone here is voluntarily, there's no contracts, but that also means that there are no guarantees. Ultimately, you are here voluntarily sharing your funds, being your brother's keeper, essentially. Impact uses our membership guidelines to outline eligibilities for these bills that will be coming in, and that allows you to plan and save for eligible expenses like mammograms, PAPs, colonoscopies, PSA tests, and even well childcare for individuals and families that have children under the age of six and under. Apart from those things I just mentioned, an eligible bill is actually defined as any new accident, illness, or injury. So anything in between there. You didn't walk into the membership with those things. That's what you can think of when you say a new accident, illness, or injury. Your household PRA can only be met with eligible medical expenses or eligible medical bills. Bills linked to a pre-existing condition would need to be sign, symptom, and treatment. Also, medication and diagnostic testing free for a consecutive 36 months before they would be deemed eligible for sharing. Okay. You'll also want to think just about anything that you have going on currently that might be considered pre-existing for you or anyone in your family. I know at the very beginning, Angie was talking about she's gone from 1,700 to 498. So even if you have a couple pre-existing conditions that are, well controlled and well maintained with a prescription, you may come out on the better side of things, because that savings again will allow you to plan for those things that after the repricing will be out of pocket for you and your household. Okay. And again, while those bills may be ineligible for sharing, if you have something going on health-wise, you still get the benefit and the privilege of saving on those related bills, because Impact still, any bill that we receive, we review and we reprice all the medical bills that are sent to us by your provider. So you still get that value of us looking at the bill and ensuring that you're paying the best possible rate for it, whether the bill is deemed eligible or not. And just so you're aware, in addition to all of that amazing value that I just mentioned, Impact actually offers one free wellness visit before your household PRA is met. And we're super, super excited and proud of that, because a lot of our good brother and sister organizations haven't adopted that. We at Impact, we believe so strongly that we want you to be well. So we were able to, add that additional value and give that to you guys at no additional cost before your PRA is met. You'll also have access to our wholesale prescription pricing discount program, which is absolutely phenomenal. I have a personal testimony. I have a pre-existing condition. I've been an asthmatic since I was 5 years old, but it's well maintained with my rescue inhaler. Outside of my rescue inhaler, I don't incur any bills from it. I haven't been hospitalized in well over 20 years. However, every time that I got that prescription refilled when I had Blue Cross Blue Shield several years ago, it was a $64 refill copay essentially at the pharmacy. That same prescription with our wholesale prescription pricing tool is $11, the same exact prescription. So that just gives you an idea of how powerful that wholesale rate actually is. And in addition to that, you're going to get free telemedicine. That's a huge feature. I used it a couple of weeks ago. If you have children, it's going to be your best friend. There is no copay associated with this telemedicine. You can simply log into your member portal, schedule an appointment. There's no limit to them whatsoever. Okay. So typically, if we were on a one-on-one call or something of that nature, we just ask any questions that you have. So I don't see very many chats in here just yet. So I guess we'll keep going. I see your hand, Stacy. Perfect.
Yeah, I have a question. So you're
Yeah.
saying if, let's say I'm an Aetna representative, you're an Impact Health Share representative. The exact same bill comes into both of our offices for the broken leg. You're going to look at that and you are going to say, this is what it's eligible for. Let's just make this math easy. It's $1,000. Are you saying that Aetna is also going to look at that and say this qualifies for $1,000? Or is, because Aetna is a national brand, is Aetna's billing going to be worth $500?
No, not necessarily at all. I was equating it because we do something very similar that most other insurance companies do as well. When you get a bill, any provider that sends a bill to an insurance company or Impact, you're not going to pay that rate that you were initially billed. The providers, by nature, they inflate the bill. I'm not sure if you've ever gone to the hospital or the doctor and been offered a cash discount on the spot. Ultimately, their process is to inflate that initial bill because they know that there will be some repricing based upon the reference-based pricing grid that healthcare providers or healthcare carriers in general pretty much utilizes when it comes to paying bills.
Right,
So
I understand what you're saying, but my question is, does Aetna, Aetna or Blue Cross Blue Shield, or because they are a larger national company, when they negotiate the price, are their prices typically lower or are your prices typically comparable?
Our prices are typically comparable because we're actually utilizing pretty much a centralized grid. Pretty much everyone is using the same standardized rates across the industry. So Aetna probably won't, we may come out on the better end of things. And Dr. M, you may be able to speak more to that, but our rates are pretty comparable to what you would receive on, any of the other national carriers.
It is similar a lot of times, and it can differ from time to time. At the end of the day, Aetna, Blue Cross Blue Shield, those larger companies, they have contracted rates. So they've pre-contracted with certain things, and they're going to give and take, just like you would with any contract negotiations. I'm going to pay you X amount for this, but maybe I'll pay you a little bit more for this. So they have their contracted rates, which are independent from ours. We use reference-based repricing, which means we look at what the federal government pays through Medicare for that diagnosis code and that procedure code in your area. So we know that, say, a appendicitis surgery is not going to be the same price as it is in New York City, as it is in, say, Arkansas. So we understand that, and the pricing does differentiate. So we look at the location where you are, the codes, and what the federal government pays for that exact same procedure and diagnosis. And then we do upcharge that. So we don't just say you're just going to pay the same rate as a Medicare rate. We go a little bit above that. And that's how we determine what we consider fair market pricing. A vast majority of the time, the provider accepts that. In instances where they don't, we do reach out to them, explain to them why, and get them to accept that eventually. But the vast majority, over 95% of the time, they're accepting our price rates.
Thank you.
That's a great question. Any other questions? Because this is your time to shine. We want to clarify any questions that you guys have.
Okay, I've got another one.
Let's
Sorry.
go.
Let's say you have family members who are in different areas of like a territory. Does that affect, like, if I am here in South Central PA, but I have a kid up in Allegheny, Pittsburgh area, does that affect her coverage?
No. Essentially, as long as their immediate family and that child is under the age of 26 and unmarried, they can remain on your Impact program. Now, Impact, there are 3 specific states that we are currently not in. So if they are residing in any of those states, that may cause an issue, but those 3 states are New Jersey at the current moment, Rhode Island, and Washington State.
Okay, great. Thank you.
Any other questions? If not, I'll go over some frequently asked questions. Maybe I'll ask a question that you didn't even know you had and answer one of those or clarify one of those if no one else has any top of the mind questions. All right, I'll take your silence as no questions. So some of the more prominent questions and just regular questions that we receive is like, who's actually eligible for Impact? And the good thing about that is that we do not, eliminate anyone from membership. Even if you have a pre-existing condition, you can join the membership. We no longer exclude anyone from the Impact membership as long as you can agree with the statement of faith, well, not the statement of faith, the statement of ethics and our code of beliefs, then you are good to go. And I see one chat in here. It says, is Impact accepted at Penn Medicine in Philly? The beautiful thing about that is that there is no network. So I would not be able to look and say, yes, that's a definitive yes. Ultimately, I think we have about an 80% acceptance rate when it comes to us being billed by the provider directly. So essentially what you do is walk in and let them know this is, my healthcare, and it has everything that they would need to bill us directly. There is no network, so you are free to visit any doctor or physician, licensed doctor or physician of your choice. All right. Let's talk about the open enrollment periods, because I'm sure you guys are used to catering to those. And the beautiful thing about Impact is that we don't have just one, but we have 12. That means that you can join the Impact membership at the top of each month. Our next open enrollment period is July 1st. So for any of you that are excited and say, let's do this right now, your next availability to join the Impact membership is July 1st. After that, August and September. And you would need to have your Impact application completed by the last day of the month in order to ensure that you and your family can move forward. When it comes to, prescriptions, I know I talked about that a little bit, but it is a little bit different than what you're probably used to. Stacy, I see your question. Is this the same program that Diane Jones is wanting to talk to me about?
Yes, ma'am.
Okay.
Sorry, that was for Angie.
I'm like, if not, I hope so. Perfect. So the prescriptions, again, when you go to the doctor, there is, again, your membership ID card. There is a group and a bin number right on the front of that card. So you'll be able to present it at any pharmacy, and they should be able to utilize and run your discount right at the point of sale. If you happen to be filling a prescription that is linked to a new accident, illness, or injury, you will need to take the prescription itself and the receipt of payment from that prescription and submit a medical expense form in order to have that amount applied to your PRA. So it is a little bit different there. There isn't a direct communication from the pharmacy to Impact that says this was a eligible bill or medical expense. So that is one of the key differences there that I want to prepare you for when it comes to prescriptions specifically. But you should be able to run your rate right at the pharmacy and pay that discounted rate. There's also a tool, a really nifty tool in your member portal that you'll be able to just type in your address. And this really works, especially if you're visiting somewhere else. You happen to be out of town, you're at a hotel, you're with family, and you need to fill a prescription. Maybe you needed to have a telemedicine appointment. Again, just another amazing piece of value. You schedule that appointment, but you don't know the area. So you can type in your address and look up the closest pharmacies. Right there, it will actually pull up the best rate for the prescription that you've been, prescribed. Everything is right there for you at your fingertips, and you can let the provider know where you'd like it to be sent. All right. Let's just talk about just re-clarifying some of those terms. I know a lot of people what's the deductible? Again, the deductible we call a primary responsibility amount, or PRA. There's 4 tiers based upon your family's budget. Obviously, the lower your PRA, meaning the least out of pocket, the higher your monthly share or your standard rate will be. So you'll want to do whatever fits your budget itself. There is a $2,500, a $5,000, a $7,500, and a $10,000. And just keep in mind that is per household. Deductibles are typically per person. So again, it just adds even more value, provides even more savings from that perspective. So once you've met your household primary responsibility amount, you now enter into the co-share, which is a 90-10 split. Okay. Co-insurance, again, we call the co-share, that 90-10 split. And I've already talked about the list of provider fees for you as well. What do you do when you go to the doctor? I gave you a scenario, but just remember that Impact membership card is going to be your best friend. You take it wherever you go. And once you've walked in, they should be able to honor whatever those provider fees are listed right on the front of that membership ID card. So your experience should be very similar to what you have going on right now if you have an insurance plan currently. It should be very similar to that. All right. Preventative care. Let's talk about that and some of the key differences. So I mentioned a little bit earlier, just some of the things that we consider to be an eligible medical expense that if you have an insurance plan right now, you may be used to those things just being a part of your plan itself, like your colonoscopies, your mammograms, your PSA testing, things of that nature. We consider all of those related bills to be an eligible medical expense. So just like any new accident, illness, or injury, we consider all those bills to be an eligible medical expense. So what you do, same process, go to the doctor, show your card. The bills that come from those things, specifically the American Cancer Association's recommendations, those things will in fact be an eligible medical expense as well. And don't forget, you do receive that one free physical essentially every year because we want you to get checked up, as well as a $150 lab allowance for the related lab work. And everything that you wanted to know as far as lab work and the related labs will be located in the guidelines that you'll need to read and make sure you understand thoroughly prior to joining the membership. Okay. And are referrals needed in order to see a specialist? Dr. M, could you kind of speak to that? Are referrals needed?
No referrals needed because again, we have an open network. You can see any provider you want, so no referral.
Let's see. You guys are a pretty quiet bunch, or either you're really clear on what this is, or
I have another I'm sorry. I have another question. I pulled up your website, and I just have a question as it relates to like the pricing. Okay, so for example, I just plugged in a family of more than 3, and it asked for the oldest person in your group of that you're okay. So the it came in, if I wanted to pay a $2,500 primary responsibility amount, The co-share is 10% and the standard rate is 605. So the 605 is what the rate is per month.
That is correct. And I'll share my screen actually, so they can kind of follow along with you. Thank you for being proactive, by the way. So you should be looking at our Impact website, the pricing screen right now. Yes, perfect. So I just entered in 12,392. Let's just say I went up to 3 or more. So what you'd be looking at here is the primary responsibility amounts that I just mentioned. Think of this as what most people would consider the household deductible, quote unquote. The standard rate would be most closely correlated. We call that the monthly share, but it's most closely correlated with a premium. That is correct. So based upon the primary responsibility amount that you select, you will have an associated monthly share that your household will be responsible for.
So the standard rate then is over on the right-hand side. Explain to me again what this co-share is.
The co-share, think of after you've met your household deductible, most times there is a co-insurance where there's an 80-20 coverage or 70-30 based upon your plan type. Impact has a 90-10 split. So after you've met this amount with eligible medical expenses, you would step into the co-share for the remaining of your membership year, where any eligible medical bill that comes through, you would be responsible for 10% of it, and the 90% would be matched and allocated and shared with the other members. And there is a maximum annually of $5,000 per year per household. So you would never exceed more than $5,000 in co-share. Essentially, that equates to $50,000. You would have to rack up an additional $50,000 worth of medical bills to ever meet your co-share max. But hey, it could happen one or two surgeries and you're there. But of those $50,000, you would only be on the hook for an additional $5,000. And after your co-share max has been met, 100% of your eligible medical bills for the rest of that year will be shared at 100%.
So your any visit at all, anything goes against the primary responsibility amount first.
Any eligible visit. So again, the only thing that can meet the primary responsibility amount are eligible medical bills. Anything new, any new accident, illness, or injury, from the flu to something more major like cancer, an unsuspected cancer that just pops up out of nowhere. The same things would apply. Anything new that you didn't walk into the membership with.
Okay. So you're on your own if you had like a previous knee surgery and then something happens with the knee, it's not part of this coverage.
The related bills would not credit towards the household PRA. You will still get the value of us repricing that bill with our reference-based pricing, but outside of that, the reoccurring damage to the knee and the bills related to it, if it has not been a consecutive 36 months with no signs, symptoms, treatment can be medication as well. If it has not bypassed that 36 months, the knee and the bills related to it would be considered pre-X.
Okay, thank you.
Any questions while I have you guys on this pricing page?
Yeah, are there any other bills that aren't covered, or are there more examples that you can kind of share with us to shed some light on that?
Absolutely. So we have an entire what we consider ineligibility list, or excluded things that are excluded from sharing, and things that you may be accustomed to seeing, like birth control and things of that nature. A couple of the other things that are included in that list are vaccinations. And there's an entire laundry list of the ineligible bills. You'd be able to find them, and I actually want to show you where in our guidelines. So give me just a second and I'll pull that section up so you guys can kind of at your leisure go through and look through the information. Again, that's why I stress, make sure you read the guidelines, make sure you have a full understanding of what it is and what it is not, to ensure that it works well for you and your family. So let me.
Specifically under those guidelines, I did read a little earlier before we got on this call that injuries arising from gross negligent acts are you know, like sports, skiing, you know, dirt biking, those sort of things, considered negligent, or is that just you know, a risky hobby?
Dr. M, what would what would the verdict be?
So those are fine. I mean, what we would consider, let's say you were drinking and driving and you resulted in an injury, we would consider that. If you were, I don't know, maybe skiing, but you were severely intoxicated, we may consider that. I don't know. In addition to that, it's kind of hard to prove some of these things. So unless there's like a police report attached to it or something like that, it's kind of hard for us to even determine that. But doing like sports and things like that, no, that wouldn't count against you.
Like Evil Knievel. You're not Evil Knievel, you're fine.
It's more so things like drinking and driving or drug use and some resulting injury, or maybe, I guess maybe even intoxication and you instigated a fight. But again, we would need like police documentation or
Yeah.
something like that to support that. So.
Gotcha.
If I could just say something real quick, I know I'm not the expert here, but I've probably done about 200 quotes so far. I think the biggest thing that people really need to understand is health sharing's been around for years. It's just, unless you were Amish or Mennonite or part of a faith-based, you weren't aware of it, because we've always just paid insurance. We either got it through our employer or we paid out of pocket. I've always paid out of pocket because I'm a business owner. The only thing that's really bad about that, and you guys can probably all relate, is insurance is always based on your income. And you've all had pretty phenomenal years the last couple of years, right? So it's always kind of based on your income, where this isn't based on your income. It's based on your age and your health. And I think insurance, in my mind, has always become big business, honestly. I'm just going to speak from my heart here. It's about paying CEOs and stakeholders, and they like to deny as much as they can. Here, Impact's about getting our health their bills shared and paid. And I think that's the beautiful thing about it. I'm local here in Chambersburg. I spoke to a few pharmacists, Stone Cipher, and at the apothecary, I spoke to Dr. Richter, a couple of the doctors, and they said, Angie, if I could only deal with health sharing, I would do it. They said, because it takes me 190 days to get paid from insurance companies anymore. And half the time they decline my bills. Where health sharing, I know I'm getting paid in about 2 or 3 weeks, and it's about getting your bills paid. So I'm just going to tell you that Mennonite and Amish are very smart people, and they've been doing this for years. So I really think this is going to be something to really disrupt the insurance industry. And the fact that I can see any doctor anytime, it's huge for me. And Stacy, I know you have a kid going to college. The fact that I know my son's in Mississippi and can go see a doctor anyplace, anywhere, it's kind of a peace of mind. So I'm not an expert. Like I said, these guys are the experts, but I'm becoming an expert quickly because I'm excited about it. So sorry.
And Brooks, to answer your question, and anyone else that has, just those questions remaining, page 13, section E, there's an entire list of things that are a part of that ineligible for sharing. I got to the guidelines straight from the Impact website, so you can access those and kind of look through it and poke through it at your leisure, so you can see that entire list. Again, page 13, section E.
Awesome. Thank you.
Absolutely.
Do you guys have, I know some of the other health sharing plans might offer a HSA plan. Is there any health savings account that you guys have?
At the current moment, we don't have that. I talk to business owners all the time, and that's one of the first questions that they ask. And typically HSAs, FSAs, they require you to have a high deductible plan. And because we're not insurance, we don't fit the bill for that. The answer right now is no, we don't have any, partnered or correlated HSA programs that we are currently working with right now. If you have an active HSA, you are able to utilize it to pay down your primary responsibility amount for those related bills. But I guess at the next year, you would not be able to go and refund it again because you wouldn't be a part of a high deductible plan, which would, grant you that leisure.
Okay.
Yes, thank you for mentioning that, Stacy. We do have one of the best, and I do mean the best, Impact for Seniors programs out there. If you happen to be over the age of 65, as long as you have Medicare Part A and B, you are able to join the Impact membership and have Impact operate as your supplement or your secondary to Medicare. Traditionally, Medicare covers 80%, leaving the person with 20% Impact after a $1,000 primary responsibility amount. You would actually, be able to have 100% shared with the other members of the program. And the pre-existing condition clause is no more once you hit 65, because anything that Medicare covers, Impact will also share in. So keep saying good morning, keep waking up in the morning. You'll get to 65 before you know it. Things will be a lot easier. What would next steps be? So Stacy can go ahead and reach out and get you guys on the membership. Eileen, I wanted to connect with you immediately after that. So what I'll do immediately after this call, once I get the recording sent out, I'll be able to offer you guys some next steps on what to do to get started to go ahead and apply for Impact Health Sharing and be connected to Stacy Brady. Okay. All right. Any additional questions before we wrap up today?
I saw someone asked in the chat, Stacy asked about plans for 65 and older. So I don't know if you wanted to touch base on that.
Yes, so I was just mentioning the 65 and older program that we have. Basically, it's a fraction of the cost, essentially. It is a single program because Medicare, you also are per person. There is a $1,000 PRA that you'd be responsible for meeting. And the way that you would meet that is, any of your deductible out-of-pocket cost expenses that you're paying for Medicare, once you have met that $1,000 out of your pocket, you then be walking directly into 100% sharing with the members of the program because there is no co-share associated with it. Medicare covers their 80% and you're left with that 20% that the Impact membership would of course share in.
Lindra, do you want to touch base on how their payment comes out each month too? They get to pick their date and comes right out of their account. Can we talk about that?
Absolutely. So when you go to, let's talk about the application, what to anticipate. So when you get into the application, you will, of course, go through and create the registration, your login and password. When you go in and do that from the very beginning, that is how you will be accessing your member portal. So make sure you utilize a password that you can remember because you'll use that very regularly. Once you've gone through that process, created your profile, you'll enter in your personal information, height, weight. You will also be entering in any other participants in your family. You'll be able to add everyone on at one time and then walk through and select your household PRA. Once you've selected the household PRA, you'll go through and there is a health questionnaire for each participant of your household. So that's kind of how we can determine, are these things pre-existing in addition to your medical history that our billing team will obviously request and pull when bills start coming in based upon what you know. Indicate what's going on in your health life so that we can obviously, process bills as quickly and as fluidly as possible. From that point, you're finished with the application pretty much. You'll indicate what's going on and you will e-sign your application. And then you go to the activation. So it'll say congratulations, but you're not finished because you haven't paid for anything yet. Make sure you go to the activation at the very bottom of the page. And once you activate your membership, you will be associating your routing and account information. Impact only deals with the ACH exclusively. So you'll enter in your routing and account number and you can select any draft date from the 15th through the last day of the month. Keep in mind though, because it is now the 14th. So if you desire the 15th, know that if you're planning to start July 1st and you are wanting your draft date to come out on the 15th, that's tomorrow. So if you didn't get your application done until the the end of this week, that's past the 15th, your draft date has already passed. So you will be billed for both your application fee, which is a one-time $79 application fee for the household, and your monthly share based upon the PRA that you select will come out that day if your draft date has already passed. So keep that in mind. You can select any date from the 15th through the end of the month. All right. Well, be on the lookout for those pieces of information, the recording. Brooks, I'll make sure I get that over to you as well. And I hope to proactively welcome you guys into the membership. Thank you for your time today. If you have any additional questions, feel free to send them directly over to me. I'd be more than happy to connect with you, or you could funnel them through Stacy, Angie. You know how to get in contact with me. So if anyone has any questions or like a follow-up call, maybe there's some additional things that they want to discuss privately, I'm more than happy to do that as well prior to you joining.
Thank you, Lindria. Thank you all for your time. I really appreciate you three experts being on here because again, there's an education piece here. So I think it's really great. And thank you, Brooks and Stacy, for putting this together.
Yeah, guys, thank you for your time this morning. This was great information, and thanks for sharing.